If you fall asleep on your right side tonight, the way millions of seniors do, the way no one has ever told you not to, you may be doing something that quietly strains the one organ you cannot afford to ignore. Quick note before we go any further. This is general education and research summary, not medical advice. Dr. Alex is an educational host who reviews published research, not your physician, not a substitute for one. Never change anything about your medications, your sleep habits, or your treatment plan without talking to your own doctor first. Now, consider a man in his late 60s. Call him Robert, an illustrative case drawn from the kind of patient scenario these studies describe. Active, independent, no history of heart disease. His only complaint, a burning sensation in his chest that came on some nights. And some mornings, he noticed his heart beating in a way that felt slightly off. Not painful, just not quite right. His doctor ran tests. His heart was structurally fine. But then a cardiologist asked him one unusual question. Robert had slept on his right side for 30 years, out of habit, because it was comfortable, because nobody had ever told him there was a reason to think about it. Here is what almost no one sits down and explains. After 65, the relationship between your sleep position and your heart becomes quietly, gradually, more consequential. Not because your heart stops working, but because a series of mechanisms that your younger body managed easily begin to compound. Today I'm walking through 5 of them. By the end, you will understand exactly what right-side sleeping does to the reflux-heart connection, to your cardiac geometry, to your overnight blood pressure, to your lymphatic system, and to a structural condition that affects the majority of people over 65. Stay with me through scenario 3. It is the one most people, and most doctors in a short visit, never get around to explaining. Before we get into the 5 mechanisms, tell me your age and where you're watching from in the comments below. I read these, and they shape the topics I cover next. Your heart sits in the center left of your chest, tilted, not perfectly vertical. It is surrounded by a tough fibrous sac called the pericardium, the heart's protective envelope. Inside that sac, the heart is suspended, not rigidly fixed, but held in a position that allows it to beat freely without pressing hard against surrounding tissue. Lie on your left side, and the heart moves very slightly toward the chest wall. In a healthy heart at rest, the pericardium and surrounding anatomy absorb that shift without difficulty. Lie on your right side, and the geometry changes differently. The heart rotates in the opposite direction. The great vessels, the aorta above, the inferior vena cava below, experience a shift in their angle and in the pressure they carry. This is not a small-scale effect in a 65-year-old body the way it was in a 35-year-old body. By 65, the blood vessel walls are less elastic. The heart muscle itself is often slightly thicker, a normal consequence of decades of pumping. The autonomic nervous system, which regulates heart rate and rhythm during sleep, responds more slowly to positional changes, and the esophagus, the tube running from your throat to your stomach, sitting directly behind your heart, has often lost some of the sphincter tone that kept stomach acid exactly where it belongs. Think of your cardiovascular system at 65 as a well-maintained engine with slightly stiffer components. It runs well. But it is less forgiving of conditions that a newer engine would barely notice. Sleep position is one of those conditions. You spend roughly 7 to 8 hours in it every night, roughly 3,000 hours a year, compounding whatever it is doing in one direction, night after night. Which is why the question, which side do you sleep on, belongs in far more cardiology conversations than it currently enters. Let me walk through the 5 things right-side sleeping does. I want you to understand each mechanism, not just the warning, but the why. The first mechanism is the one Robert's cardiologist recognized. It connects 2 things that seem completely unrelated: acid reflux and irregular heartbeat. After 65, they are more connected than most people realize. Your esophagus runs directly behind your heart, separated by only a thin wall of tissue. When stomach acid backs up into the esophagus, acid reflux, it does not stay quietly in one place. It can irritate the vagus nerve, the major nerve that regulates heart rate and rhythm during sleep. The vagus nerve is essentially the body's master slow-down signal. When it is irritated by acid sitting against tissue it was never designed to touch, it can trigger what cardiologists call vagally mediated arrhythmias. episodes where the heart's rhythm shifts, slows, or skips in a way that feels like a flutter or a pause. In a younger person, this tends to be a nuisance. In a senior whose heart already beats with slightly less electrical precision, it can be the difference between a normal night and a night where something feels off enough to worry about. Think of the vagus nerve as a wire that runs through your chest. Acid reflux is like water dripping on that wire, night after night. The short circuit it causes doesn't destroy the wire, but it doesn't leave it alone either. Research published in the journal Gut and analyzed in cardiology literature has consistently documented an association between gastroesophageal reflux and supraventricular arrhythmias. A review examining the esophageal cardiac connection found that acid-induced vagal stimulation is a recognized trigger for atrial rhythm disturbances. The connection is well enough established that some electrophysiologists now ask about reflux symptoms when evaluating patients with intermittent palpitations. On the sleep position piece, a study published in the American Journal of Gastroenterology found that right-side sleepers experience substantially longer periods of acid contact with the esophageal lining compared to left-side sleepers, the exact mechanism feeding vagal irritation. If you experience nighttime palpitations, a fluttering sensation in your chest, or reflux that wakes you, bring those two symptoms together at your next appointment. Tell your doctor both and ask whether sleep position may be contributing. Never adjust heart medications on your own. Sleep position is something you can discuss and trial safely with your doctor's knowledge. That is mechanism one. The second is different. It is not about acid at all. It is about the geometry of the heart itself. The second reason cardiologists pay attention to right-side sleeping in seniors is structural. It is about where your heart sits when you are lying on your right side and what that position asks of the muscle over time. When you lie on your right side, the heart, oriented to the left, must, in a sense, work against gravity. The left ventricle, the strongest pumping chamber responsible for pushing blood out to the rest of the body, now sits in a position where it is not in the same relationship to the outflow vessels as it is when you are upright or lying on your left side. The pericardium, that fibrous sac surrounding the heart, contains a small amount of lubricating fluid called pericardial fluid. In right-side sleeping, the heart rests differently within that fluid, and the outflow tract of the left ventricle, the path blood takes to reach the aorta, sits at a slightly less favorable angle. In a young heart with maximum elasticity, this matters very little. In a heart that has been pumping for 65 or more years, with an aortic root that is less supple than it once was, these angles matter more. Think of a garden hose with a slight kink in it. Water still flows, but the pressure behind the kink builds slightly, and the hose at the bend carries more strain. Night after night, in a heart already doing extraordinary work, a slightly less efficient outflow angle is not nothing. Echocardiographic studies examining lateral sleep position have documented measurable differences in cardiac geometry between left side and right side positioning, including shifts in how the left ventricle fills and empties. While research in healthy seniors continues to develop, the structural relationship between right-side recumbence and cardiac output mechanics is established in the cardiovascular physiology literature. This does not mean right-side sleeping is dangerous for a healthy heart. It means it is worth being aware of, particularly if you have been diagnosed with left ventricular hypertrophy, mild valvular disease, or any condition your cardiologist has flagged. Ask directly, is there a preferred sleep position for my specific heart condition? That question takes 30 seconds and deserves an answer. The third mechanism is the one I told you to stay for. It involves something your body does automatically every night, and that right side sleeping quietly interferes with. Most people know their daytime blood pressure number. Very few know that their overnight blood pressure is equally, some cardiologists would say, more important. And sleep position affects it in a way that has been documented, and that directly raises risk in people over 65. If this is helping you so far, type the number 3 in the comments right now. It helps this reach more seniors who need it. In a healthy cardiovascular system, blood pressure drops during deep sleep by roughly 10 to 20%. This is called the nocturnal dip, and it gives the heart its essential rest period, the time when the ventricles are under the least pressure, when the arterial walls have a chance to recover, and when certain repair signals are strongest. People whose blood pressure fails to drop during sleep, called non-dippers, carry a significantly higher risk of cardiac events, stroke, and kidney damage. The research on this is not ambiguous. Now, here is what connects this to sleep position. Your autonomic nervous system, the system that manages that nocturnal dip, is exquisitely sensitive to body position. Right side sleeping affects venous return differently than left side sleeping. It alters how the inferior vena cava, the large vein returning blood to the right side of the heart from the lower body, is positioned and, in some individuals, compressed. Studies examining 24-hour blood pressure monitoring in seniors have found that sleep position is among the factors associated with how well the nocturnal dip is preserved. A flatter dip is associated with more cardiovascular events over time. Think of the nocturnal blood pressure dip as the tide going out. The ocean floor, your arteries, gets a chance to breathe, to reset, to dry out slightly. Non-dipping is the tide that never fully goes out. The floor never gets that rest, and over time the accumulation shows. Research published in the Journal of Hypertension and the American Heart Journal has documented the association between non-dipping nocturnal blood pressure and major adverse cardiac events in older adults. The role of lateral sleep position in modulating venous return dynamics, and thereby influencing nocturnal pressure patterns, has been explored in cardiovascular physiology literature. If you take blood pressure medication, or if your doctor has ever mentioned that your control is inconsistent, this is worth asking about. Some modern monitors can track overnight readings. Ask your physician whether 24-hour ambulatory monitoring has ever been done for you and what your nocturnal pattern looks like. Do not adjust medications on your own. But understanding when your pressure is highest and what may be contributing is exactly the kind of information that makes a short clinic visit more productive. That is 3 mechanisms. The fourth involves a system in your body that almost never comes up in a cardiology conversation, but probably should. Your lymphatic system is the body's secondary circulation, a network of vessels that carries immune cells, removes cellular waste, and returns fluid from the tissues back to the bloodstream. Most people know it only in connection with swollen glands when they are sick. But during sleep, particularly in older adults, it does some of its most important work, and sleep position affects how well it does that work. The central vessel of the lymphatic system is called the thoracic duct. It runs up the left side of the body, alongside the spine, and empties into the venous system near the left collarbone. When you sleep on your left side, gravity assists the thoracic duct's drainage. Fluid moves more naturally toward the point where it re-enters the bloodstream. When you sleep on your right side, gravity works against this drainage. The thoracic duct must work harder. And in an older lymphatic system that is already less efficient than it was at 30, that added resistance matters. In the context of cardiovascular health specifically, the lymphatic system helps clear inflammatory debris from arterial walls. Poor lymphatic drainage is associated with increased systemic inflammation, one of the consistent contributors to arterial disease in the research literature. Think of the lymphatic system as the overnight cleaning crew in a building. Left side sleeping lets them work with the building's natural layout, using the slope of the hallways. Right side sleeping sends them uphill all night. The building still gets cleaned, but not as thoroughly and not as efficiently. The anatomy of left-sided thoracic duct drainage is well established. Research examining glymphatic and lymphatic clearance during sleep, a rapidly growing field, has highlighted lateral sleep position as a significant variable in how effectively the body clears inflammatory and metabolic waste during rest. A 2019 paper in the Journal of Neuroscience examining sleep position and clearance dynamics is among the foundational pieces in this area. Lymphatic health is not something you can track with a home monitor, but the implication is clear. Left side sleeping supports a system that does nightly cardiovascular maintenance work. This is not a reason to panic about the nights you slept on your right. It is a reason to understand why left side sleeping is increasingly discussed in longevity and preventive cardiology circles. The fifth scenario affects the most people over 65 hours, and almost nobody connects it to the heart. It involves a structural condition that often starts with what simply feels like heartburn. Studies estimate that roughly 60% of adults over the age of 60 have some degree of hiatal hernia, a condition where part of the stomach slides up through the diaphragm into the chest cavity. Many of those people have no idea. They know they have heartburn, they take an antacid, they do not know what is causing it structurally, and they almost certainly do not know that right-side sleeping is one of the most reliable ways to make it worse. In a hiatal hernia, the stomach, which belongs below the diaphragm, has partially migrated upward. This means it is now sitting in closer proximity to your heart and your esophagus. When you sleep on your right side, the stomach's position in the chest cavity shifts in a way that increases pressure on the lower esophageal sphincter, the valve between the esophagus and stomach. That valve, already weakened by years of use and often by the hernia itself, is more likely to allow acid to escape when you are on your right side. This brings us directly back to mechanism 1. More acid in the esophagus means more vagal nerve irritation, more potential for arrhythmias, and more disrupted sleep, which itself raises cortisol and overnight blood pressure. The compounding effect in seniors is significant. A hiatal hernia, plus right-side sleeping, plus a slightly stiffer autonomic nervous system, that is a combination that creates more nighttime cardiac stress than any of those three factors alone. Think of the diaphragm as a lid. Hiatal hernia is a lid that doesn't close perfectly. Right-side sleeping is tilting the pot. When the pot tilts, whatever was threatening to overflow does. The relationship between hiatal hernia, GERD, and vagally mediated cardiac arrhythmias has been documented in both gastroenterology and cardiology literature. Research published in the World Journal of Gastroenterology has described a gastrocardiac syndrome, a pattern in which reflux-induced vagal stimulation produces cardiac symptoms, including arrhythmias and atypical chest discomfort. American College of Gastroenterology guidelines specifically recommend left lateral positioning for patients managing GERD, a recommendation that carries direct cardiac implications in this scenario. If you experience heartburn, nighttime regurgitation, or chest discomfort that you have been managing with antacids, ask your physician whether a hiatal hernia evaluation is appropriate. This is often diagnosed straightforwardly with an upper GI study or endoscopy. Do not change any acid-reducing medications on your own. But if sleep position has never come up in that conversation, bring it up. It is a low-risk, simple, evidence-backed adjustment with meaningful upside. Which of these 5 scenarios sounds most familiar to you? The reflux and palpitations, the overnight blood pressure, or the heartburn connection? Tell me below. Your answer may help the next person who reads it. If you wake at night with chest pain that feels pressing, squeezing, or like pressure on your sternum, call emergency services immediately. Do not wait, do not take an antacid, and go back to sleep. Chest pain at night that does not resolve with a change in position within a few minutes, especially if it comes with shortness of breath, jaw pain, arm pain, or sweating, is a cardiac emergency until proven otherwise. If your heart is racing, skipping, or beating irregularly for more than a few minutes, tell your doctor at your next visit, and if it is happening right now and you are concerned, call your provider. Arrhythmias in someone over 65 deserve evaluation. Many are benign, some are not. The evaluation is what tells you which one you are dealing with. And if you have been prescribed heart medication for blood pressure, arrhythmias, heart failure, or anything else, do not stop or adjust it based on anything in this video. Sleep position is a complement to your medical care. It is not a substitute for it. What you can do right now, tonight, without a prescription and without risk, try sleeping on your left side. Use a body pillow behind you if you tend to roll. Elevate the head of your bed slightly if reflux is a concern. Even 4 to 6 inches makes a documented difference. These are low-risk, guideline-consistent adjustments that take nothing away from your care and may add something meaningful to it. After 65, right-side sleeping puts your body in a position that works against 5 mechanisms simultaneously. 1. It increases esophageal acid exposure, which irritates the vagus nerve and can trigger irregular heartbeat. 2. It places the heart in a geometry that is less favorable for left ventricular outflow. 3. It may impair the nocturnal blood pressure dip, the nightly reset your heart depends on. 4. It works against thoracic duct drainage, slowing the lymphatic clearance that reduces cardiovascular inflammation. 5. For the 60% of seniors who have some degree of hiatal hernia, it compounds every one of the above. Left side sleeping addresses each of these. The research pointing in that direction is not from one study or one researcher. It is convergent from cardiology, from gastroenterology, from sleep medicine, and from lymphatic physiology. That convergence is meaningful. None of this means you will have a cardiac event if you sleep on your right side. Many people do for decades without obvious consequence. But if you are looking for low effort, no cost, no side effect changes that a 65-plus body can make, sleep position is one of the few where the research is surprisingly consistent about the direction. Talk to your doctor. Ask whether left-side sleeping is appropriate for your specific conditions. If you take blood pressure medication, ask whether 24-hour monitoring has ever been done to check your overnight pattern. If you have reflux, ask whether your sleep position has been included in the management plan. If this gave you something genuinely useful, share it with one person in your life who is over 65 and takes a blood pressure pill. You may be starting a conversation that matters, and it helps this channel reach more people who need it. Now, if this raised questions about what your blood pressure is actually doing while you sleep, there is a video on this channel about the most dangerous time of day for blood pressure in seniors over 65, and the one thing almost everyone does in the morning that makes it spike before they have even had breakfast. I will see you there.